right. Hello. Welcome to All Things Odd. I am Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
And we are going to share our YouTube, and I'm going to have Dr. Galloway talk about it real quick. We're doing pretty good with our
Yes.
11 subscribers.
Well, that's more than 8. We were stuck at 8 for a while. So you can see this is our YouTube channel. I think the videos are easier to sort through this way and easy to send to somebody that doesn't have Facebook or something. But if you go to that top right corner, you can subscribe, and then you can turn notifications on if you want, and it will let you know when we have a new show, typically Thursdays, 12:30 Mountain Standard Time. Sometimes we'll do like a replay or something, but almost every week we have a new episode. So that's another way that you can access it there.
Yeah. All right. So today we have a really cool topic because today in Colorado, it was weird. We woke up and it was raining all day long. And I think there were some pictures of people like even in Estes Park that had some hail. And so we thought it would be a great idea to talk about what happens when the weather changes. So if you have ever thought about, you can feel a cold front coming in, or there's some different barometric types of changes. Like we hear that from our patients a lot, and so we wanted to talk a little bit more about some weather changes and what can happen to your ears. So we're going to first talk about ear aches and hearing loss. And Dr. Galloway and I had talked about this, and we had some thoughts about this, but I'll have Dr. Galloway kind of talk about it real quick first.
Yes. So the reason that you get an earache is because when the barometric pressure drops rapidly, the pressure outside your ears goes down before the pressure inside your ears can accommodate that. And so the result is a pressure imbalance, which can cause fullness or popping in the ears. So if you've ever gone on an airplane, you know that feeling of the pressure is like building, 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 and you can feel there's a pressure differential between the inside of your head and the outside of your head. And then you swallow or move your jaw, chew on some gum, something like that, and it equalizes. Sort of the same thing, but obviously the air pressure outside isn't changing like when you're rising in altitude on an airplane. So it's a little bit different, but you can still use those same methods to kind of pop your ear, usually yawning, moving your jaw down, chewing gum. Breathing exercises, antihistamines or decongestants can be helpful. I know that we have patients maybe that travel from Estes Park, and they'll say, if I go, from Estes to Denver a couple of times within a week or something, my ear won't clear. So it can be from altitude changes too. So any of those tips still work. It's just a little bit different of a pressure shift.
Yeah, and it makes sense too, with the changes in pressure on one side of your eardrum to the other side, especially in babies. So if you've ever traveled and there was like a baby next to you, and when you ascend or descend, they start crying, it's because when you're first born, your eustachian tubes, which is the tube that goes behind your eardrum to that middle ear space, starts off horizontal, and then it starts to angle downwards as you mature. And so there's a lot of, if there's any type of mucus or like a runny nose, it's very hard and can plug that up. If they're crying, then that can also kind of add to that. And so it gets very uncomfortable. And of course, babies don't know how to like clear the pressure or equalize the pressure. And so that's why a lot of them may cry, because it's uncomfortable or it feels weird. And I remember when I used to travel with my young kids, I'd always have them eat something when we took off or when we landed, or drink, a bottle or whatever it is, right? Or I would nurse, and that would help. And then they wouldn't feel that pressure, because that you're getting that motion to work, right, for them to help them equalize that pressure. And so we've also talked about earplanes on the show, where they are filtered earplugs that allow the pressure to be eased slower on that one side of the ear drum that is more exposed to the pressure of the airplane or the airplane, sorry, or the cabin, versus what's going on. And so that can help. They're called ear planes, and you can get them at a drugstore. You can get them at your local audiologist's office, but they're fairly inexpensive. And I usually have my family always stick a set of those into their travel bags, because especially with my son with some allergies and everything, he has a hard time equalizing the pressure. when we fly. So those are some different.
I did see those at Target locally somewhere. So I think that you can buy them at Target. And they do come with a pediatric size or an adult size. I actually buy the pediatric size for myself. So you might want to kind of look at it and see if you have a smaller ear, you might actually need the pediatric size too.
Good ideas. All right. So if you're just joining us, what we're talking about are just weather changes that can occur with your ears and with your hearing. So we've kind of talked about people that have earaches, why they have earaches with weather changes or pressure changes, and then also hearing that can affect hearing loss as well. And then we're going to go into what happens like with people that have vertigo, lightheadedness, with the pressure changes. We had this huge weird front come through Fort Collins, and I don't know, possibly in Colorado. And so this is what stemmed our conversation today. But I'll have Dr. Galloway talk a little bit more about what's going on with your balance system in different areas that could be going through some different changes, and you can notice that with some weather changes.
Mm-hmm. Yeah, the big one I think is Meniere's disease. Usually those patients suffer from vertigo that comes in really distinct episodes. And so they sort of know, what the triggers might be for their episodes, or they'll say, like, I can feel that it's coming on because of the weather. So I'm going to kind of read about this recent study in Germany that was really interesting. So the researchers asked their patients with Meniere's to keep a daily vertigo diary to document their system flares. Or their symptom flares. And then they also looked at that against, what the weather had been doing. So to test a hypothesis that changes in the weather solicit symptom flares, the study's investigators logged local hourly air pressure as well as absolute and dew point temperature over the time period the patients recorded symptoms in their vertigo diaries. And they found that the mean change in air pressure differed one day prior to the onset of the patient's reported Meniere's disease symptom flare. So specifically, they noted that there was an increase in symptoms after an increase in air pressure, but not after a decrease in air pressure. So if they had an increase in air pressure, then one day later, that's when people with Meniere's had symptom flares. So that's interesting to know that it's actually like the following day of the change in the pressure that they may have, more symptoms. I've had, Meniere's patients have really specific triggers, like they know that if they don't get enough sleep, they may be more likely to have an attack or something like that. So this is interesting to know that, somebody with Meniere's could possibly not plan for it, but, sort of be aware that there may be an episode coming if there's going to be increased air pressure. The other thing is migraine. So not just vestibular migraine, but all migraine patients. There's definitely a sensitivity between migraines and weather or climate variation. So we have another study here that, let me see. Okay, so this is kind of looking by region too. So qualitative analysis of patients reported migraine triggers have noted that changes in weather precede migraine attacks second to psychosocial stress. So migraine sufferers in northern climates have noted that migraine symptoms seem to occur more frequently in seasons with more daylight. A group of patients studied in the United States, migraine sufferers reported high humidity, low pressure, and rainy days have the ability to trigger migraine headaches. And this isn't looking at vestibular migraine totally separate than regular migraine, but we do know that, there is a subset of patients that have a particular vestibular migraine. And so I would expect that their symptoms would be increased with this high humidity, low pressure, and rainy days. So there's also been objective reports of weather and climate change on migraine headache symptoms. Periods of meteorological phenomena of warm, dry winds, known as Chinook winds in Canada, have correlated with a greater probability of migraine headache symptoms. So again, migraine sufferers are very aware of this, but changes in condition, whether it's their environment or their diet or something like that, could trigger a migraine. And so it kind of looks like, these weather patterns have been associated with that as well.
Interesting. So As you were talking, I was thinking about like people in the Pacific Northwest that might be more wet, right?
Mhm.
Or I was even thinking Alaska, but more for the weather changes when it is, I think it's the summer when they have longer days and light.
Mhm.
I wonder if that is a trigger at all, or if it's more of the pressure in the air versus the light that can trigger migraines. Be
Yeah, because it
interesting.
says, in northern, frequently in seasons with more
Yeah.
daylight. Yeah, I wonder if there would be a less likelihood when they're having those like 30 days of night or whatever it is.
Right, right, right. Interesting. Huh.
Yeah.
Okay. Yeah, so that's kind of interesting. And then the last part we thought would be kind of interesting to look at is, are there changes in tinnitus with weather changes? Now, with our population, we see a lot of tinnitus patients here, and my tinnitus patients can tell. They're like, there's a weather front coming in. I was like, what? And then I pull up my app and I'm like, oh yeah, for sure there is. And so it's really interesting. I thought that we would look into that as well. But what's interesting about some changes in tinnitus is we found a couple of different articles, and they said that any increase in air pressure, moisture level, or a major difference in pressures that can cause tinnitus to worsen. And these can be from anywhere from like normal air pressure, and increases in humidity can cause a spike in that ear pressure, which is what we talked about in the beginning. It might be the pressure changes outside, and then it has affected the ear pressure, right? And then it can affect the tinnitus as well. But most of the things that we found, whether it is a weather front that comes in, are secondary to making the tinnitus worse. Okay. So in 2015, we found an article from the European Archives of Otorhinolaryngology, and they did a study, and they basically looked like Googled tinnitus and seasons. And so according to the study, they found that there are some significant seasonal trends for tinnitus. Um, but again, to me, I feel like this is secondary. So what they found is, like, when you have more common things coming in with a weather front, that can lead to colds and flus, right? So let's walk through this. Colds and flus, you can have more congestion and sinus pressure. And then with that, that could be something that exacerbates your tinnitus, because as you have a cold or a flu, you can be more plugged up. If you're more plugged up, you don't hear the sounds in the environment as much, and you hear inside your head, right? Anybody that has a head cold will hear inside your head. And so that could increase the perception of your tinnitus, but that's kind of more secondary to,
Right.
oh, here comes the weather front. Now you've got a cold. Now you've got maybe even like, what is it? It's not tertiary, but but it's like, it's if this then that type of thing,
Yeah.
right? So the cold and the flus. Again, another secondary thing would be maybe reduced physical activity, right? Reduced physical activity could lead to higher blood pressure to hypertension, which also makes tinnitus more noticeable with that blood flow, right? And maybe reduced physical activity is because the weather front came in, and like nobody wants to get outside, and they just stay inside, and it's like you want to just like cuddle up and be warm, and and
Mhm.
watch a movie or something like that, right? So again, secondary, and then even the next one too. And then the last one is depression and stress. And so again, with these colder months, with again maybe rain that comes through, which is what stemmed our conversation today, especially I would say in that Pacific Northwest area too, where it's a lot more rainy, you can have that seasonal affective disorder. And with that, you can have depression. And both stress and depression are known to increase tinnitus or exacerbate tinnitus. So it's interesting. I with the weather front, I could say that with our tinnitus patients, it could be that with the weather front, you have that pressure in your ears, or you are there's so many things that can make your body change, which can
Mhm.
then increase your tinnitus. So it could be just like a really direct effect of weather changes. It could be a secondary effect, right, where this affects your sinuses, your allergies,
Mhm.
whether you want to stay home or whether you don't want to exercise or whatever it is, right? And then that's even two reasons past the weather change. So it's really interesting for tinnitus patients. I think that there are so many things that can exacerbate tinnitus, but I do notice that my tinnitus patients that come in definitely can tell when their tinnitus is getting worse, because they're anticipating even a weather front.
Mhm.
They've even checked the weather ahead, and they know that that happens. And so now they anticipate it. So many different reasons. I think it's really interesting. And, again, we're not saying that people are making things up, but there are definite people that are out there, whether it's changes in their hearing, changes in their ears, changes in vertigo, changes in tinnitus, that can tell that a weather front is coming in because they already have these symptoms before the weather front comes in.
Arthritis. I feel like it's arthritis patients will be like telling
Yeah,
you that
that's true
there's
too.
a cold front coming in because they can feel it in their joints.
Yep, yep.
So,
Or Raynaud's syndrome or something like that. Yeah, where
mhm,
you have that numbness in your fingers and your joints because of the cold front. So,
mhm.
if you have any other ideas or if you experience some changes, put it in the comments so that we can kind of take a look at that too. Because if you are a patient that has the tinnitus, vertigo, hearing loss, pain in your ears, or arthritis, things that you can tell that are coming in, then we definitely would love to know about that too. And I think it's kind of really cool when you can tell that a weather front's coming in before.
Yeah.
I can see migraines can tell for sure though because it already has that drop in that weather.
Mhm.
But with that, so we'll keep it pretty short today and sweet. We hope everybody's staying safe on the roads here in Colorado. I think that it's probably stopped for the day, especially our friends in Estes Park, though we heard that there was hail up there. So be
Mhm.
careful. And yeah, we will close off this show for today, but we will be back with a whole new episode next week. So thanks for joining us, guys.
Thank you.